My name is Susan. I have a little boy and I'm currently expecting a little girl. I had cervicitis, which is the inflammation of the cervix, which can be caused by physical trauma, chemical irritation, physical irritation, and apparently allergies as well. I contracted cervicitis through a relationship that I had had when I was between the ages of 16 and 17. That was very sexually abusive. Because of the sexual abuse, it caused my cervix to swell and I let it go untreated for a long time. And when I finally did go and get it treated, I think really the trauma and the traumatic pain that it left me with was just, that was the worst part. And it's easier for me to talk about what happened to me now because of the fact that I've kind of dealt with it. Because of the nature of my cervicitis, I was left with traumatic pain. So I did experience pain after the infection was cleared. I had pain every month during my period, and it's really intense lower back pain. It was almost worse than when I had the actual cervicitis. And then when I got pregnant, I would have it once or twice a week sometimes, and the pain would be so intense that it would be really hard for me to get up. It really affected me physically with, I had really bad nausea and vomiting with my son. It made things a lot harder. And then when I went into labor, I also had terrible back pains, terrible back labor, and it was just so bad that I was unable to get up out of the hospital bed once I got to the hospital. Got my epidural extremely early and I was not really able to walk around like I should have, and it slowed down my dilation a lot. In labor, able to push through it and like not really think about it because I also had like a baby in my pelvic area. The pain did affect me postpartum. I was still getting a lot of those spells where my back would it would ache and throb, and even still with this second pregnancy, I still get pain in my lower back where it just aches and throbs, and it's so painful. And I know a lot of that has to do with like the baby's positioning just kind of triggering that pain. It has made intimacy during pregnancy really difficult. The way that my sexual trauma has affected my intimacy, since it happened when I was between the ages of 16 and 17, and I'm almost 23 now, I feel like I've had the chance to deal with it a lot better, so it doesn't affect my intimacy anymore. But when I was younger, it did make it really hard for me to connect with my partners. I always question people's motives. With me, I didn't trust anyone to actually stick around. I don't know if that was so much just my insecurities or if it was what I had been through. And I don't know if that was so much just my insecurities or if it was what I had been through and all of the trauma that I went through in that relationship. It really just made it hard for me to connect with my partners, and I really wasn't able to connect with any of my partners until I got with my current partner and the father of my children. Because I dealt with it at such a young age and I have such an understanding partner that's willing to talk to me and help me through, anything that might be going on in my head. When I was between the ages of 16 and 17 when it initially happened, I was really ashamed to talk about it. I was seeing a therapist, but I never told them. In fact, I've seen 3 therapists, never told any of them exactly what happened to me. My partner is the only person that really knows all of the details. What really triggered my initial emotional response was when I told a specific family member what had happened to me, and they essentially just told me that I was lying. Ever since then, anytime somebody is skeptical, I'm able to open up and tell them what's happened. It just kind of makes me want to shut down. It was hard enough that I had to go through it without people, you know, doubting me. That I dealt with it, I kind of stopped believing myself about it. With my partner, we were actually just talking about the traumas of our own childhood. I was able to talk to him about it because he had been so open, and I cried. I felt like a huge weight was lifted because I felt like he was the only person that like listened to me and believed me when I told him what had happened and the way that my family member responded to me. But now, the only thing that really triggers any sort of emotional response is anytime I have a really bad spell with my traumatic pain, and it's just because it kind of brings up and solidifies that yes, this did happen to me. Something that those are 8 months of my life that I'll never get back. Talk about it. Don't be afraid of people not believing you, because it's an experience that happened to you, and that's something that you're not lying. I believe you. It's in thousands and millions of people who will believe you, because you speaking up can save somebody else's, you know, life. And anyone that's dealt with cervicitis, it doesn't always leave traumatic pain. Mine left traumatic pain because I got it through sexual assault and sexual abuse, and also because I didn't take care of it for a long time after I got it. Any sort of sexual, any sort of sexual activity, it can be caused by just regular sex, just regular physical irritation. It can be caused by, you know, if your pad has some sort of chemical in it that your body might not be used to, if your pH balance is off, and apparently allergies as well, which I didn't know that before. I do suggest going to get it checked out anytime you have any sort of pain in your reproductive area. Just get it checked out. Even if you aren't sexually active, you can still get cervicitis.
Sexual assault can affect you mentally as well as physically, whether we were assaulted years before or recently before birth. I remember before my first birth not even considering what had happened. Why would I need to revisit that? Growing up, this affected my intimacy and relationships that I would be in. I associated any sort of intimacy with my assault. I'd never expected to be so deeply affected while in labor. I spoke with my midwife about this very often. Having a supportive and understanding provider is very helpful. Sexual assault can affect us in many ways.